introduction, and thanks to each and every one of you and the people of Malaysia. I've visited your beautiful country in the past and look forward to returning in the future. I have some brief critical updates regarding the COVID-19 pandemic. The first is regarding the virus itself, SARS-CoV-2. It is mutating rapidly in response to worldwide vaccination. The mutations in general are becoming more numerous, and they are progressively making the virus less deadly and less virulent. So through a process of mutation, the virus is escaping the effects of the vaccines, but it is becoming a less serious illness as a general trend. The current large percentage of cases right now is due to the Delta Plus, and now the Delta 10 Plus variants. These are variants that have progressive mutations in part of the virus that is allowing it to escape the effect of the vaccine. Now, we've worked over the course of the last year, and we recognize several things. One is that the virus is very easily treatable, and we don't need to treat everybody, but high-risk people over age 50 with medical problems should receive early treatment to reduce hospitalization and death. And that's done with a combination of about 4 to 6 medications. They include oral drugs that have antiviral activity, anti-inflammatory and steroid medications, and then forms of blood thinners. And these are in the published protocols that were cited in the American Journal of Medicine and Reviews in Cardiovascular Medicine. These are supported in the United States by the American Association of Physicians and Surgeons and the Frontline Critical Care Consortium and other leading groups. So COVID-19 is treated early at home, and we should not wait for the hospital for it to be treated. Now, the second point is that once an individual recovers from COVID-19, they have robust, complete, and durable immunity with a negligible risk of ever getting COVID-19 again. So this is very important. We've learned now that the virus does not spread asymptomatically, so we don't have to do tests in individuals with no symptoms. We can just focus on people who are acutely sick with the virus today. And I'll just turn my attention to the vaccines. We have an array of vaccines. In Malaysia, you have a messenger RNA vaccine, the Pfizer vaccine. You have an adenoviral product, the AstraZeneca product, and then you have a whole virus killed product called Sinovac. What we know about the vaccines is that coming out of the clinical trials with earlier versions of the virus, they had some protection against the development of new cases, but the effect was overall small because so few people developed COVID-19. What we know now, unfortunately, is that the vaccines have largely failed into having any impact in the pandemic. The Sinovac vaccine, in fact, because it's a whole virus vaccine, seems to promote mutations. And so the Sinovac was responsible, we believe, for the formation of the Delta variant out of India and now the Lambda variant out of Peru. We know that there are additional mutations. We have the Epsilon variant coming out of California due to the Pfizer, Moderna, and Johnson & Johnson vaccines. So the vaccines are losing their effect. Currently in Israel, which exclusively uses Pfizer, it's having no effect whatsoever. 80% of individuals with COVID-19 in Israel have been fully vaccinated, and that matches 80% of the population. So the vaccine appears to have lost any effect in Israel. In the United Kingdom, they have a different blend of vaccines. They have Pfizer, Moderna, and AstraZeneca. It's a little bit different. About the last I've checked, 42% of individuals with the Delta variant have been fully vaccinated, implying a large number of individuals are not responding to the vaccines. The CEO of Pfizer yesterday reported that he thought the overall protection of the Pfizer vaccine was now down to between 30 and 40%. In the United States, and across Europe, we have great concerns over safety. So as the vaccines fail, we have about 50% of the United States citizens have received the vaccine, and we have our Centers for Disease Control has confirmed 11,000 deaths after the vaccine. Last week, there was a lawsuit filed with data from our Center for Medicaid and Medicare Services with it's believed 45,000 Americans have died after the vaccine. In separate analyses from McCullough and Rose using U.S. data, they have shown that 50% of the deaths occur within 48 hours of the injection, and 80% of the deaths occur within a week after the injection. 86% of the time, there's no other explanation. It looks like the vaccine is directly related to death. And the reason why this is the case is the vaccines, certainly Pfizer, Moderna, Johnson & Johnson, and AstraZeneca, they all trick the body into producing the dangerous spike protein, the original spike protein that was on the wild type virus, which is the strongest of all the viruses. And the body produces the spike protein for an uncontrolled period of time. We don't know if this is 2 weeks or 4 weeks or more. We know at least 2 weeks by measuring circulatory levels of spike protein. The spike protein causes inflammation and damage in the organs where it is seated, and it circulates in the body, damaging blood vessels and causing blood clotting. So if the vaccine, and we know this occurs now through autopsy studies, it goes into the brain, it goes into the heart and other vital organs and starts to produce spike protein, which damages those organs. Our US FDA has official recommendations and warnings regarding Pfizer and Moderna causing heart inflammation called myocarditis. We have 2,000 cases of myocarditis that can lead to sudden death and heart failure in young individuals, particularly young men. And then we have data and warnings on in the United States on Johnson & Johnson, which is similar to AstraZeneca, for the development of blood clots in the brain in women ages 18 to 48. Similar warnings are for AstraZeneca across Europe and Canada. So these safety numbers are very alarming. There are immediate calls in from the evidence-based consulting group in the United Kingdom, which is the principal consultant to the World Health Organization, and they have officially recommended to stop vaccination and remove these products from the market to the MHRA in England. We have physician petition letters in, as well as nursing letters in to our US FDA to not approve these products and begin to remove them from the market, given the safety signals that we're seeing. And we have a paper from Bruno and colleagues, 57 authors, 17 countries, really worldwide, that have told government authorities that if they can't evaluate and get a handle on safety, to go ahead and shut down the program because the vaccines aren't working and they clearly are not safe. So we are at a great point of tension, because in the world, the individual citizens understand the vaccines don't work, are not safe, and now there's mandates and other coercive moves to give vaccinations to people who don't want them. And since the vaccines don't work and they're not safe, it's my recommendations that we go ahead and shut down the vaccination program. It'll be easier for Malaysia to simply treat the small number of people with COVID-19 and let them get through the infection, as opposed to injure and hurt the population. We don't know what's going to happen with these vaccines. They don't appear to be safe in the short term, and we have great concerns that long term they're going to cause damage. We've had the first U.S. Senate vaccine injury town hall, and there were patients who developed neurologic problems about 6 to 9 months after the vaccine, including seizures, blindness, paralysis, inability to swallow, being debilitated into a wheelchair. I'm already seeing these patients in my clinical practice, and I'm greatly alarmed because so many people volunteered for the vaccine early on without information on long-term safety. So I really believe very strongly that Malaysia should shut down their vaccine program as we speak. Thank you.